In the labyrinthine corridors of destiny, the threads of fate weave silently and unseen. The Phase 3 CRISTALLO trial addresses the efficacy of fixed-duration Venetoclax-Obinutuzumab, VenO, compared to standard fludarabine, cyclophosphamide, and rituximab, FCR, or bendamustine rituximab, BR, in newly diagnosed chronic lymphocytic leukemia, CLL patients. This study enrolled individuals with a cumulative illness rating scale score of 6 or less and creatinine clearance above 70 milliliters per minute, excluding those with DEL7P, TP53 mutations. A total of 166 patients were randomized to receive either VenO or FCR-BR. The primary objective was to assess undetectable minimal residual disease uMRD, less than 1 CLL cell in 10,000 leukocytes, in peripheral blood through next-generation sequencing at the 15-month mark.
Quick take. The CRISTALLO trial compares VenO to FCR-BR in CLL patients, focusing on achieving uMRD as the primary endpoint.
The primary endpoint was met, as 81.3% of patients in the VenO group reached uMRD compared to 54.7% in the FCR-BR group at 15 months, p-value equals 0.0004. Secondary outcomes showed higher uMRD rates in both peripheral blood and bone marrow at end of treatment with VenO. Although progression-free survival data is premature, VenO demonstrated fewer progression or death events. Safety profiles aligned with previously known data, with no high-risk tumor lysis syndrome noted post-obinutuzumab debulking. The authors conclude that VenO significantly improves response depth relative to chemoimmunotherapy.
Quick take. VenO shows superior uMRD rates compared to FCR-BR, with a favorable safety profile and less disease progression.
Short quiz clinical vignette. Question. A 68-year-old male with newly diagnosed CLL has a creatinine clearance of 75 milliliters per minute and no TP53 mutation. He is randomized in a clinical trial comparing VenO to FCR-BR. At what uMRD rate does the trial's primary endpoint occur in peripheral blood at 15 months with VenO? Option 1, 81.3%. Option 2, 54.7%. Option 3, 25.6%. Option 4, 65.0%.
The answer is option 1. The CRISTALLO trial's primary endpoint was achieving uMRD in peripheral blood with an 81.3% rate in the VenO arm at 15 months.